veterans. My name is Devin Clarkson, and I'm a social worker with the HUD-VASH program.
And my name is Deisha Washington. I'm also a social worker that's within the HUD-VASH program.
HUD-VASH is one of the two programs offered through Healthcare for Homeless Veterans. And we're here today to talk about how HCHV, Healthcare for Homeless Veterans, interacts with suicide prevention and our two programs and how they complement each other. For veterans that are unhoused, we do have different services that Deisha and I are going to talk about today and how to get connected to those programs also. Mental health clearly can be very affected when one is without housing.
So within our homeless program for our veterans, we're able to connect. We have the opportunity to connect them with the resources that they need, as well as connecting homelessness back to mental health. We realize that there are many factors that contribute to the homelessness population, as well as mental health, such as financial issues, mental health stability, and homelessness. That's what our program is focused on. Through our programs, as well as our community agencies that we have connections with, we're able to assist our veterans just secure a better lifestyle overall, and that's what we try to do within our program.
So that's the HUD-VASH program. That's one of the two programs. And I'm going to talk about our second program, which is transitional housing. Transitional housing is short term. So the idea is typically up to 4 months, sometimes up to a year, depending on the program. But it's a place for veterans. It's congregate living. So you might be sharing an accommodation, a room with another veteran when you're there. Meals are provided. It is free for veterans experiencing homelessness. And it is a place to get stability, to get housing stability, to get your feet underneath you, to save some money while you're at it, while you're looking for other housing. It's not permanent housing, of course. You can hear it in the name, transitional. However, it's a place to get that stability to work on your housing goals while you're with us. We contract out for that program, and staff there are trained and work together with our Healthcare for Homeless Veterans social workers to provide services for mental health, to keep connected to the VA and the services we offer in-house, and to achieve that housing stability. The VA's goal is to end veteran homelessness.
Yeah, and just to touch on a little bit about the HUD-VASH program, just to take a deeper dive, I'll kind of walk you all through the process of once they're out of transitional housing and once they receive a voucher. So once veteran receives a voucher, they're assigned a social worker, and they'll work with that social worker to identify the housing that they like. We don't want to make it as where you have to choose a specific housing, but we'll provide them options, and they'll apply for that housing as long as it's within their voucher amount. And we both agree that it's something that they're able to afford to avoid going back to homelessness. So once they get the voucher, they apply for the housing that they want. They all move into that housing, and that's where our community resources come in. So such as SSVF, Veterans Matter, Military Missions Act, they all assist with move-in fees, obtaining different housing kits, as well as furniture. And then once we move on to them moving in and getting everything that they need, once they're settled in, they are assigned to a case management schedule. And that case management schedule can go from weekly, bi-weekly, monthly, and quarterly, and sometimes yearly, just depending on how stable they are, how comfortable they are, and just how the social worker best sees fit for the program as well as the veteran.
So now I'm going to talk about the best way to make contact with the two programs of HUD-VASH and transitional housing that we spoke about, and our walk-in clinics. We have those at all three of our locations: Salisbury, Kernersville, and at the South Charlotte Clinic off West Tyvola. Feel free to call. However, we encourage all veterans to come in person to connect with our services. It is a walk-in clinic. There's no appointment needed. You can just come to the reception area in each of those locations, check in and say you're there for Healthcare for Homeless Veterans. We'll sit down face-to-face with you, learn about what your current situation is, and then connect you to the available resources. You can plan to spend typically between a half hour to an hour there, sometimes connecting with us. Thanks so much for taking the time to learn about our programs. Suicide prevention is everyone's business here at the VA, and we do care about you.